Okay. Who's on first?
We still need to add.
Yeah,
review.
I'm gonna do, I want to call to order the West Lafayette Community School Corporation regular meeting Board of School Trustees. One of the things we'd ask also, if you can, as best as possible, speak into the mic just to help from a sound standpoint and for the transmission of the live stream. I'm going to ask for approval of the agenda for the September 7th, 2021 regular meeting with Mike. You want to go into the amendments for initially as well.
First of all, what I'd like to do is add an item to review and consider to modify the reopening plan. And we would like to have Dr. Chester Ho involved, and he is involved. He will be calling in on a Zoom call, and so we will adjust where that is on the agenda according to Dr. Ho's schedule. Also, we may need to adjust the professional development services. That is not an addition, but simply a difference in order. If we have a representative, Laura Falk, be present. So with those additions.
Need a motion, please?
So moved.
By Mrs. First by Mrs. Witt, seconded by Tom Schott. All in favor of the motion, please say aye.
Aye.
And opposed, hearing none, this motion carries. Approval of the minutes of August 2nd, 2021 regular meeting of the Board of School Trustees. Need a motion, please.
Move approval.
Moved by Dr. Springer.
Second.
Second by Mrs. Austin. All in favor of the motion. Are there any corrections or changes? From my standpoint. All in favor of the motion, please say aye.
Aye.
And opposed? Hearing none, that motion carries. I'm seeing communication from the audience, I think mostly have to do with the budget hearing, unless I'm missing something. I have two people signed up, so we'll go ahead and move on to the budget hearing, and then go ahead and take the formal or the communication from the audience on that. Ross, go ahead.
Okay, thanks, Alan. Here a couple weeks ago we had the budget workshop where we reviewed the budget items, levy, assessed valuation, and so on. And so then, as required by the DLGF, we have to advertise the budget and the levies, and we also advertise the bus replacement plan. So as required by the DLGF, Budget Form 3 was uploaded to the DLGF website. Bus replacement plan was also uploaded, and then also was put on our website. Then our next step would be on October 4th, there would be an adoption of the budget, by the school board.
Okay.
So just to summarize, our budgets that are advertised, and that was on the Form 3 that was uploaded. We had a referendum operating fund of $7 million, rainy day fund $1,375,000, debt service $6,582,514, education fund $21,450,000, operations $8,331,185 for a total $44,738,699. That is an advertised increase over the 21 budget when we advertised that of a little over 3%. Advertised levies, $7 million for the referendum, debt service $6,789,160,000, operations fund then of $5,383,900. So total levy advertisement $19,173,060. That's around 5.5% over the 21 advertised. Our current tax levy is $15,182,401. I expect once all this washes out, DLGF adopts our budget, our expected levy will be in around the $16 million range for 22. Now keep in mind these levies are the taxes, and you won't collect all of them, but the levy is property tax. other revenue, because you look at the levies and you say, well, how are you gonna fund those kind of budgets with that low levy? You have other revenue that comes in that's not included in the levy, like your state support and other miscellaneous revenue. So that would add to your levy amounts. The bus replacement plan then calls, it's a 5-year plan. Basically, you're concerned with year 2022 of replacing one bus, an estimated cost of $144,130. Then every year we revise the plan, go out 5 years. They expect the life of a bus to be around no more than 12 years. When we had the work session last week, I know I made a comment. There's always concern about the debt fund, how you're gonna pay the debt with that levy and so on. And I made a comment, there was bond surplus funds that by statute you use for debt reduction. I made a comment there was around 3.6 million available. That was only from the 17 bond. There are other bonds, that was only from the 17 bonds. That wasn't the total from all the, because we got 4 bonds that we sold. So I didn't clarify that at the last meeting. That was just from the 17 bond. I anticipate, we're kind of winding down on this, a side note here, on the construction projects. I would anticipate like to the October meeting, maybe have Tim Slaughter come in, update us where we're at on finishing up the education wing and the performing arts. We could also give an update on the bonds, you know, expenditures, where we're at so far to date. And, you know, perhaps we could do that in the October meeting. So, Alan, that's kind of the summary of where we're at on it. And there's no action for the board, but just open for, you know, as a public hearing on that budget, on those budgets.
Okay. And Alice, is yours on the budget or is it something else?
This is on the quarantine for the
Okay, so I'm gonna let, well, I'm gonna let, because we should have had you initially speak. And Laura, not to call you out, are you good for a few minutes if we continue this process and then we'll come to you? Okay, sorry about it. Troy, go ahead if you would, please. And then Alice, I'm gonna let you come back up and speak on that issue because you should have had you talk in the current agenda items and I didn't, okay? All right, sorry for the change. Go ahead, Troy.
My name's Troy Janes. I live at 1515 Ravinia Road. Although this was a hotly debated topic in the last school board election, Mr. Sloat's presentation at the budget work meeting clearly shows that the school's debt payments related to the RDP construction projects exceed the related tax revenues, and he just mentioned this, by nearly $1 million in the budget, less if you remove the budget padding. The proposed solution for this shortfall is to use excess bond funds. Indeed, Mr. Sloat stated that this was the plan all along. Using borrowed money to make debt payments is like you or I taking a cash advance on our credit card to make our monthly credit card payment. The result is that we have too much debt and pay a lot of extra interest. I would encourage the administration to consider alternative ways to meet the debt payment shortfall. For example, the West Lafayette Schools Education Foundation has been soliciting funds to help pay for the RDP projects. According to the foundation website, the foundation has raised $1.6 million specifically for the construction projects. Given that the projects are essentially completed and that there are excess bond funds, it is unclear what these funds will be used for. Using them to help pay for the project-related debt seems like an perfect use. Then we could perhaps use the excess bond funds to reduce the debt that we have to pay interest on. According to publicly available information, the schools issued $95 million in bonds to pay for $83 million in construction expenses and bond issuance costs. That means there should be a surplus of about $12 million, and it might be as high as $19 or $20 million. I have that calculation. I will email it to you after the meeting, and I have copies for anybody else who would like to see it. Why the schools borrowed so much is confusing to me, but since it's there, I would suggest that the administration look into whether it can be used to reduce our debt. Dr. Yin asked in the budget work meeting if the school's debt could be refinanced. Mr. Reiling explained that legally we have to wait for 7 years. I believe he was referring to the call provision in the bonds that allows the bonds to be redeemed early starting in 2027. I don't believe that there is any prohibition on the school corporation repurchasing debt on the open market. At current prices, not considering transaction fees, that $20 million could retire about $16 million in bonds. At the coupon rate of 5%, that could save the school corporation about $800,000 each year in interest payments. That's enough to wipe out the shortfall. This proposal may or may not be feasible, and it depends on the actual amount of excess bond funds. We submitted a public records request shortly before Mr. Killian's retirement, requesting information about the bond account balances. That request was denied because, according to the administration, it did not have that information. Before voting on the budget that has been presented to you, I would encourage the board to obtain a full accounting of how much is in the excess bond funds, as well as information on how those funds will be used. I would also ask that that information be released to the public, because it is, after all, our money that is used to repay the debt. Thank you.
Thank you, Troy. Comment or anything else? Okay.
No, I really don't have a comment. I would like to comment on his insinuation that we didn't respond to some of the debt information when the request was made. It was asked for a current month, and at that time, it was like 2 days after the current month, and the calculation wasn't available.
All right. Okay, and Alice, why don't you go ahead and make your address, and then we'll go on to that next budget, or that next agenda item. Go ahead, please.
Thank you. I feel a bit like this is a non sequitur, but
Go right ahead, sorry.
thank you to the board. My name's Alice Pauley. I'm a faculty member at Purdue. I live at 1809 Garden Street, just down the road here. I have a kindergartner at Willis, and a fourth grader at Willis. I'm here to urge caution in changing our quarantine practices. Quarantine is still an important tool in keeping COVID at bay. So is testing. I urge us to keep our same current quarantine practices until we see what happens in less careful districts, and to change quarantine practices only with associated testing policy changes, which would be new, I assume. I kept my children at home last year because I did not want them to be guinea pigs for COVID. We know the Delta variant is more contagious than strains last year, that more children are in hospitals, and hospitals are full. Our decisions may be being based on science as best we can, but science on Delta is just coming out now. My kids aren't vaccinated because they can't be. Please don't change policy for our younger kids in particular until we see what this change does elsewhere, and make sure that testing is implemented so we can catch asymptomatic spread among our unvaccinated kids. I want to note my kids in kindergarten, they are not social distancing. Masks are variable because it's hard. And so I ask, as you make this change, that you not just think of the high schoolers, but you also think of the 5-year-olds. Thank you very much.
Thank you, Alice, appreciate it. Okay, we will now go on to our professional development services, and I guess I'll go to you, Mike, with respect to that.
Laura, I think we have some questions. Maybe you could expand. If you would like to come up to the microphone and just kind of expand a little bit on the professional development series, professional development agreement that we have with the company that we're involved with, and how you see that working, possible benefits of that.
So you want an update on the company?
Virtuoso, and
Okay.
as much as you can. I know
Virtuoso.
you'd expressed that there's some pieces that you're not fully prepared with. You just thought if there were any
Right, but
questions.
I'll do the best I can. So Dr. Renee Aziz came to us last year and did a professional development piece during an all-staff day in January, I believe, of last year. Am I correct? I think it was. February, thank you. And we learned about cultural iceberg. We learned about educational debt that children might be bringing into the school that we need to be aware of, like are they coming from a broken home? Do they have materials? Have they been transitioning from one school to another, what are the challenges that we need to be aware of? And then bringing that into our awareness for more equitable education and just being aware of the challenges that children are bringing in, that not everybody is coming from a stable home with the same income, with the same food securities, etc. After that, she gave us some worksheets and some activities that we were supposed to be working on. And she has been invited to come back for this school year as well as next school year to continue our work on educational equity. In September, we are going to be working on completing her work that she recommended that we do before our meeting, and we will be seeing her then in February of next year. You're welcome.
Does anyone have questions specifically to Laura?
So, yeah, Laura, if you could, I mean, I know that you're brand new in your role. So, you know, be on the job for 3 weeks and then run. But this is very much in response or as a part of this marathon that we've been running with regard to DEI issues and concerns coming out of those questions. Is your feeling that this fits well into the work that you're doing, you're trying to lay out? And that's really the goal, is that whatever barrier a child is facing when they walk in the door, this training is intended to be comprehensive for all of our staff so they can be aware of those. Is that, I'm not trying to put words in your mouth.
No,
but
that's
is that,
exactly what. I think that our world has changed so much that we come in, not that saying all teachers are doing this, but you come in thinking everybody should be at the same level, everyone has access to things, and we don't really, you know, when you're sitting on that treadmill going 50,000 miles in a minute when school starts, it's hard to keep everything in your head. And so this discussion that we had February really kind of opened up that process of just starting to talk, having conversations about things we need to be aware of, and things that we, as supportive teachers, want to keep in our minds as we're working with the students. Does that make sense? Okay.
I just want to say this, in my short time here, the things that there's several things that I've appreciated about being at West Lafayette, and Laura is one of those, and I've appreciated your conversations, and also we invited Laura to our administrative meeting, and just know that there is a support for this conference and also for the work that Mrs. Falks is doing, so thank you.
Thank you.
So with that, okay.
Oh, sorry.
Go ahead.
Thank you so much for doing this, and I really appreciate that. And I just have a general question. And so sometimes some kids have kind of concerns and uncomfortable moment because of other comments or something, and but they don't feel comfortable to report the situation, and they don't necessarily know how to handle it. And I wonder whether our schools have any kind of hotline or something for them to get a training regarding how to deal with it. And because I heard from my kids about not something they experienced, but their friends experienced some uncomfortable situation, and
Right.
but they felt, I don't want to report friends, but I don't know how to deal with it, kind of, yeah.
So one of the things that we're going to be working on for this year is to develop a student advocacy group. Since it's only 3 weeks in, we've kind of stayed away from stressing our kiddos out. We are looking at age-appropriate student mentors who could be trained for facilitating that discussion. And we are looking at juniors and seniors right now, especially the seniors. We're going to wait a little bit until they're finished with their college applications and just kind of getting caught up with recommendations and scholarship applications. But Mrs. Sheffield and Mrs. Dobson and I are going to be talking about identifying those students that would be good fits. We're going to invite them, see if they're interested, and then we will work at identifying a good facilitating training that we can then have them part of and start developing that program. So we're thinking about trying to reach out and start the process in October after they've been identified.
Okay, thank you. Yeah, another thing is I feel, sometimes some kids makes insensitive comments. Maybe they did so not out of bad intention, but they didn't realize they may hurt others, so that sort of thing will be in the training, right? So
Yeah,
yes.
and we are working, I mean, there's been a lot of things that we've been doing that I've been doing with the high school in terms of reaching out to talk with the children. Again, we're really fresh, new into the school year, so it's just a little inundated. It's overwhelming at times to start being in there at the same time that they're just trying to learn their schedules and get acclimated to the new year. But that is part of that, is to be able to be trained on microaggressions and then also how to have a conversation and what to do in those instances.
Thank you.
So I just want to clarify, I know obviously you're focusing in the 7 through 12 at the junior senior, but this is a K through 12. All teachers will go through K through 12, and the program is intended to extend K through 12. Is that?
Yes, but we can't, we felt it was best to have upperclassmen be part of that facilitating because it would be harder to have a fifth grader trying to have that conversation, so.
But the strategies will vary, but
The strategies will vary based on the age range, and the counselors will be, we're going to be talking with both Willis and Wellis as well, with the counselors. I'm going to their quarterly meeting, and that's one of the things we will be talking about. So it's fresh and new, but that is on the plan, that's in the work, so.
Thank you, Laura,
You're
so
welcome.
much, and thanks for the extremely short notice.
Yeah.
And your
Oh, that's
presentation.
fine.
Thank you.
So we,
I'm sorry, did somebody else have a question? I'm sorry. Go ahead, Mark.
so anyhow, what we need is simply, we need an action item to approve the agreement with Virtuoso.
Okay, we need a motion, please.
so moved.
Moved by Mrs. Witt,
Second.
second by Mrs. Austin. Additional questions or discussion? Okay, all in favor of the motion, please say aye.
Aye.
Opposed? Hearing none, Roberta, that motion does carry. Timing-wise here, we're at about 5 till 7, where Dr. Ho will be, and you're set to go. Yeah. Thank you. You're released. Thanks. Ross, is the investment resolution a short process?
Yeah, it's short.
Okay, let's go ahead and go to item number 4, please.
Yeah, we do annually a resolution that allows the school corporation to invest in investments to banks outside our political subdivision. So when we take quotes on certificates of deposits, to meet state public depository requirements, if they go to a bank that's outside of your boundaries, you need approval from the board to do that. Currently, our CDs are all within banks within the current boundaries, but then in the past we had banks from Indianapolis that had higher rates. So this would cover us for another year to allow give us more options on investments.
Okay, need a motion to accept the investment resolution.
So moved.
Moved by Dr. Springer,
Second.
second by Mr. Schott. Additional discussion or questions? This is a annual event. I mean, that we do.
Right.
Okay. Questions? Okay. All in favor of the motion, please say aye.
Aye.
And opposed? Hearing none, that motion does carry. Mark, anything? Is he there? Okay, we'll go ahead and move now to our reopening plan. Mike, I'm going to give you just the floor initially on this, and then Dr. Ho hopefully will be online as well.
Is Dr. Ho with us? Not yet. Just real quickly, with I would like to compliment the community and families, the school leadership, staff members, and the school board for their previous actions to follow the advice of local medical personnel addressing the concerns of COVID and the safety of students, individuals working in the schools, and visitors. I appreciate the actions of our neighbors, and school safety is the highest priority, and school safety is the highest priority, and the progress of students with their academic endeavors at all levels is also at the top of that list. I have appreciated the leadership of the Indiana Department of Health during this very unusual time in the past 18 months. I've admired the work of the local professionals and the work of our school district physicians in working with the local health individuals. I have consistently used Dr. Ho's comment, "We are making public decisions and not personal decisions." This past week, Governor Holcomb issued an executive order altering the procedures in regard to mandatory quarantines, with the emphasis being on keeping students safe and engaged in schools. A Zoom meeting was held last Friday that included a medical professional, Dr. Ho, a representative from the school board, building administration, school nurses, our school attorney, and representation from the central office. The new guidelines were discussed and a proposal made to present it to the whole board at the regular scheduled meeting set for September 7th, which it was to evening. It was the consensus that the board had adopted the school reopening plans in regards to COVID, and it would be a consistent message to again follow these procedures. I have, and interestingly enough, and I'll go off script here for a little bit, we understand that the governor did this to encourage districts that were not masking to mask. Because if you were not masked, then you did not have these quarantine choices. Interestingly enough, I get a update from the Indiana School Board's news, and the number of districts that have going to mask is immediate. So he was successful in that. And I think what I want to talk about first is from that. Here's what the Duneland schools said. The Duneland schools, which is Chesterton, Valpo, which are two high-achieving schools in northwest Indiana, were not masked. They immediately went to mask. And this is what the Duneland schools said. They have lost this year, because we don't have necessarily this data, they've lost 3,600 days of instruction this year to the quarantine rules, which is huge. Here are some comments that came out of the meeting as I took notes to that few of the students who have been, these are comments, that few of the students who have been quarantined from contact tracing have tested positive for COVID virus as a result of the context at the school setting. And here I want to say this, the school has no data to defend this statement rather than observation. The school believes that a substantial number of students in grades 7 to 12 have been vaccinated. However, there is not collected data to substantiate this statement. These are statements that we heard during the meeting. That the students and staff have consistently followed the expectations of wearing masks, and that there continues to be a strong effort to maintain proper distancing during lunch periods. As I heard our patrons say, and at the lower levels, we understand that that's a bit more difficult. That having in-person learning is more effective. The availability of timely testing of students for the COVID virus to get them back into the classroom and the community is presently limited. Just know that. A lengthy quarantine requirement is burdensome for families and may be creating more safety concerns away from the school setting. That the West Lafayette schools have shown the flexibility and timeliness to readdress the issue of quarantine procedures if this were to indicate a negative impact. So that I wanted to share those comments.
Dr. Ho is available audio only at this, right? So, and everyone needs to, if they have questions as we go into that, Dr. Ho, are you there?
Yeah, I am.
Okay.
I'm happy to say a few words too.
Yeah, go ahead, please.
Yeah, and sorry about the echo, and apologize for not being there in person. I'm helping my son move in for college. I think what I would say is, overall, have had an incredible effort working with the administration, the teachers, the school nurses, the staff, the teachers. What we have, the advantage we have, and I'm a West Side alum, so just like Alan and others, I think others in the school board, and we really take a pride in kind of where West Side is from an academic standpoint. I use an example of my daughter who got mono a couple years ago, and was at a bar from the door because she was so worried about missing school. So I think a lot of people have issues with stress in the home, mental health in the home. Being in school is the right thing to do, and I think we have the advantage. Again, my pride is speaking through to the follow through that our parents and our students make. That we started the school year, I hear from Joel every day, I hear from the nurses every day, and we had a little bit of the mask debate going on that other school districts had, but by and large, you come into school, everybody's wearing a mask. And our younger kids are wearing them, they're being educated and encouraged to wear them. None of them are going to be as good as an older kid at wearing them, but they're still doing a really nice job. So that's kind of the backdrop that I think we have an advantage of, and I'm not making fun of other schools or knocking on other schools, so I don't want that tweeted out, but I'm just saying we have an advantage of where we sit. So the masking has been done well, everybody's on board, everybody's encouraging it. We have also a year's worth of data. So all of last year's data, the nurses and I and Dr. Biancoli, who couldn't be with us today, tracked every single case, student, teacher, staff, para, staff, everybody. We tracked everybody that's positive. So we've been able to follow it. We've had a couple instances where a teacher who, exposed a bunch of classrooms and students that are positive in classrooms, and we are very good with the videotapes and quarantines, and we've been very aggressive with that, and we've been able to keep our numbers low. I think people then say, well, if we're doing all that, then we should continue that and keep it low. However, I do think there's a balance, and I'll tell you my bias, and I run a hospital system as well as the school district. I'm the chief medical officer at Carl Health is my day job. My bias is always going to be, let's try to get as many kids in school in a safe way as possible. So if we aren't masking correctly, then we obviously aren't going to just say, hey, masks are good enough. So we're not going to blindly follow policy. And I've been benefited from the school board, from the school administration, that we can turn on a dime, that Mike and I have the same relationship that Rock and I had last year, where we can, send a couple texts, jump up on the phone and change on a dime, and grab our principal and do what we need to do. So my comfort level is in our data that our quarantine population is not who's turning positive. Our close contacts are not the ones that are turning each other positive. Our data is overwhelmingly that people that are at home, that are not wearing masks, are turning each other positive. And this is incredibly contagious. So I just saw a family in my office on Friday, has 8 kids, 2 parents, and in November, all 10 of them were positive. You and I have all had times when somebody gets sick and somebody else doesn't at home. 2 of your kids are sick and the other one doesn't get sick. Mom never gets sick, but dad got sick. You've never seen it before where 8 kids and 2 parents get turned positive. So it's overwhelmingly our exposure positivity comes from isolated families, then they come to school. So we're getting ones and ones and ones. We're not getting 3s and 4s in classrooms. So I feel very comfortable that we're masking well, that the guideline is using evidence to be able to say, the school is not the transmission route. So let's lighten up our quarantines so that we're keeping kids in school for social and academic reasons. And then we are still going to track every single close contact so that we know if anyone turns positive, we turn on a dime, we talk to you all, and we adjust as we need to. And that's the way we handle things on a 24/7 basis. So just want to give you that backdrop as you have questions, give you my perspective. Thanks.
Okay, let's go ahead and take some questions. I guess we can take a motion to accept this plan and then begin this process. Is that reasonable?
Yeah, after those discussions and listening to Dr. Ho in our meeting, what I'm asking is the motion up to the board at this time is to accept the executive order from Governor Holcomb as presented and revisit the decision in a timely manner if the condition of the Delta variant worsens within Tippecanoe County and within the West Lafayette schools. That would be the motion. And then, and you could take out the Tippecanoe County if you wanted to, but you could make that motion, you could have a second, then you could have discussion upon that motion.
That's what we'll do, okay. So need a second, or a second on the motion, please?
Someone needs to make the
Yeah,
motion
why-
rather than me, so.
First, someone make the motion, and we'll have a second.
I'll make the motion.
Moved by Dr. Springer. Second by Mr. Marley. Okay, now discussion and questions for Dr. Ho. So-
I have a question.
Yeah, go ahead, Rachel.
Dr. Ho, in particular, I'm very concerned about lunchtime. It's crowded at the elementary, it's crowded at the intermediate. I know they're doing their best at the junior, senior, but it's crowded there too. It's kids off, no masks, half hour, talking to each other every day. And I'm not as comfortable, because of that period of time in the day. Can you help me feel more comfortable?
I would say to you that that period of time in the day is a portion of the day no different than athletics. It's no different than I think the motion has been made specific to the classroom setting.
Right.
So if we have an exposure at lunchtime, we're still gonna follow our process. They look at video, they talk to the people who they sit around. We've gone through this for a year last year, and we had a high infectivity rate last year as well. So I think we follow the rigor that we can, as much as we can. We're doing the best we can, and that's the rigor that we put ourselves to. So I can't say to you magically I'm gonna make you feel more comfortable, but I can tell you that if we have a positive in the lunchroom setting, and that person, we probably will quarantine those folks, which is why we are still gonna track. And the only thing, I don't have a governance vote. Obviously, you can amend your motion as you wish with, outside advice, and you asked me to join the call. One thing that we talked about in our meeting on Friday was, that we're gonna maintain the rigor of parents and students notifying the nurses. The nurses are gonna track close contact, because if anybody turns positive, we're gonna still notify those folks, and we're gonna go through whatever we need to. And that evidence might actually make us come back to you and reverse it. So we're gonna reverse it if we see a trend. We have not seen a trend, but your lunch hour question specifically is, we're gonna watch it closely, and if somebody turns positive at the lunchtime, we'll probably still quarantine those folks, but we wouldn't quarantine everybody at the lunch.
Okay, so I just want to make sure that I understand this. So if Bobby is a third grader, Bobby comes up positive for COVID, the students in his classroom may not be quarantined, but anybody that he's seated by at lunchtime would presumably be quarantined.
Right now, yes, that's probably what we would do. And again, we look at it case by case. So we would talk through that with Amber, and we talk through that with Nicole, and we would track those folks. And yes, we probably would, because right now we would actually quarantine around the classroom and around lunch hour. So we're going to continue probably to quarantine in any situation, and we're going to be more conservative at the younger grades because we take every case individually.
And Chet, just to clarify, that would be the same then with athletics, right? Because they're not masked. And is indoor versus outdoor
Sorry.
athletics any different?
Can you repeat that? Sorry.
So just for athletics, similar situation, if it's an indoor sport, practice or a game, because they're not masked, they would be subject to quarantine, but what about outdoor sports or indoor and outdoor treated differently?
Yes, yep. So again, today, we look at that pretty carefully as far as who's indoors, who's outdoors, how much time is exposed. JV separate from varsity. Joel goes through a rigor with us that, I'm not trying to speak for him, and he's sitting right there in the meeting, I can't tell who's there, but Joel goes through a rigor with us, and he's done an incredibly strong job of looking at that. And so we'll continue that rigor without just following the executive order, because the executive order in our mind is kind of strictly in the classroom setting, sitting masked, with a 3-foot distance. So
Dr. Ho,
athletics at lunchtime would be debated the same way we debated today.
Go ahead, Amy, go ahead.
thank you. I would like to ask you the same question I asked Dr. Bianculi a month or so ago, which is, what's the latest information on when the vaccine will be available to our youngest students?
The current information that I know of is that the trials are still ongoing, that I have not heard anything about going under 12 yet, but 5 to 12 is kind of the category that's being researched now. So another way to put it is you have to get in front of the ACIP and the CDC in order to get these things pushed through, and so that's one reason why Pfizer was first. It's just Pfizer kind of put their application in the month before, so we should see Moderna, for example, come through very shortly for the same indication that Pfizer has, because they've all used the same age brackets. But then the lower age bracket really kind of boils down to when the data collection is full enough that they have comfort to present that topic, so I don't have a date for you right now.
Okay. I don't know
Go ahead,
if
Dean.
I'm doing this correctly according to Robert, but I would like to move to table this discussion. I heard both Dr. Ho and Mike say that we don't have the data to know whether or not we're having in-school transmission, that we have a feeling and we have observation, but we don't have hard data. And what I would like to propose is that we table this until next month, and during that time period, we take that data. That'll give us another month of Delta. It'll give us another month of being back in person with our full capacity rather than the 60 or 70% we had last year. It'll give us time to learn what happens at other Indiana schools, and it will give us better information to make this decision. So I move to table, please.
We have a second?
I second.
Okay, second by Dr. Yin. Discussion, and I guess one question I would have, Chet, do you have any response to that in terms of where, from the data standpoint?
Yeah, I guess I want to make sure my words weren't missed, and I didn't say we didn't have any data, so I know you were just paraphrasing, but I want to just clarify. We have all of last year's data. We have this year's data that shows that we're not seeing transmission, that when we track people in quarantine, that the number of quarantine positives is, I don't have a number off the top of my head, because I'm standing in shorts in South Carolina, but the tracked number patients that turn positive is really low compared to the number of ones that turn positive randomly every day that are turning positive because of family member exposure and unmasked homes. So we have incredible numbers of unmasked positives coming from home exposures, and we have virtually none that I can even think of off the top of my head, maybe one or two, in quarantine patients that were, sorry, I call them patients, students that have turned positive. So the numbers are incredibly in the favor, that quarantines have been conservative and haven't seen transmission where we went, oh, I'm really glad we quarantined those 12 people because 4 of them turned positive. I mean, that we've had none of that, none. So I feel comfortable with the data. If you wait another month, you collect another month's data, I totally understand that. But I just want to make sure I clarify, we have not seen positives among quarantines like we're just seeing individual random positives that turn positive because mom and dad or brother or sister turned positive. So I just want to make sure I'm clear on that. I apologize if I wasn't.
Dr. Ho?
Go ahead.
Dr. Ho, may I ask a question? Okay, so just now when you talk about the low percentage of positive cases, and you are talking about those who wear masks, right, in close contact but wear mask. And so right now, just now, Rachel mentioned the lunch time, and actually I also have a question about the recess time. Even though it's outdoor, I noticed that many kids actually don't wear masks and don't have social distance. And will that be a concern? I just don't have that knowledge about it. And then if in that situation, will those kids be at least be notified if there's a positive case in a group or something like that?
I understand your question. Help me if I don't. So last year we had strong, masking outdoors during recess. We maintained that through the school year. So we masked during recess last year. And so our rigor, you know, the bubble that we try to put our kids in from a safety standpoint has always met the standard of the community and the CDC or been more rigorous. As far as today, right now, if you walk out that door and you guys talk in the parking lot, you're talking without masks on unless you wear one. Because the CDC says right now the world is a little different. We've got at least a 50, depends who you talk to, a 50 to 60% vaccine ratio. So today, you can have a Purdue football game with no one masked because they're outdoors. But unless you're indoors, and if you're in an indoor setting, you have to wear masks. So we're following that same rule. So your question about recess, we debated that with our reopening plan about should we mask everyone outdoors, but the guidance today across the country has been outdoor activity is okay to be unmasked, unless you choose to wear a mask. So we've chosen to follow that path. And the country, we haven't seen positive cases that has suggested we shouldn't do that today, so we're following that same.
Do we still have any
Thank
other
you.
questions regarding the tabling motion?
I just want to say that since the very beginning of this, we have followed the advice of the people that are the experts, and there's been debate on both sides of just about every decision we've made, and I don't know why we would change that now.
Any other comments?
I have,
Yeah, I
Go ahead.
sorry, I just,
interrupting, I know, so I can't see you.
I
Go
would
ahead.
like to have more clarification about the new plan, because just now Dr. Ho said, you know, for the lunch, the kids in during lunchtime and those close in contact may be quarantined, and there's some kind of uncertainty. I wish there are more like a certainty there, and will we exactly quarantine those kids in close contact or not? And what if we vote, what will we vote for? Because actually, I think those kids might be in bigger danger than those who are masked in classroom. But what's exactly our plan for that?
I'm not sure, right?
Sorry, my question,
Well, so-
I didn't
so
make it clear.
What's your question?
So, yeah, my question is, so, you know, the new policy actually is about the kids who wear masks, right? So if they wear masks, even if they are in close contact, they don't need to be quarantined. But in the situation Rachel mentioned just now, and during lunchtime, they sit together for half an hour talking without a mask, and will we quarantine those kids who are in close contact or not? So exactly, because just now what I heard is like, we probably will, there's I don't feel there's a clarity regarding our policy.
Chet, do you understand the question? Do we have a definitive, I mean, it's a case-by-case basis is what you had said earlier, but I want to make sure we're taking your words correctly.
Yeah, we will continue to review every case. I think just so everyone's clear, and you have your choice as a board to vote. My comfort, and Dr. Biancoli and our nurses have discussed this. We discussed it as an organization, and we discussed it as a leadership team of the clinical organization. I think we're very comfortable saying that we have not seen a lot of close contacts and quarantines turn positive. I mean, I say a lot. I don't mean to mince my words. I don't know if we've actually had any. I'm having to do this from memory, and I apologize for not looking at it in advance. I found it about the school board meeting this afternoon, and I just don't have a laptop with me when I'm moving my son's furniture. So I'm pretty sure, my memory's pretty good, that we have no cases that I can even think of in a year and a half or year and however long we've been in school, that we've had positives that are quarantines that turn positive in close contact. So all of our case positives have been persons turning positive as one. What I mean by one is they're a prime, so they turn positive from home, not because somebody at school. So I'm very comfortable saying that as an organization, it's not just my opinion, that we're following the guidance of our parent company, our school board, our board of health, et cetera, that I think we should try to quarantine. Nothing's 100%, that we're only talking about the classroom setting. So athletics, lunch, recess, if we have positives, we will still go through the rigor and we will still quarantine those folks. We will always side on the side of conservative for those. But in a classroom setting, I think what I understand the executive orders say is in a classroom setting where children are fully masked, that we will not quarantine just those people within the radius they currently put in the close contact quarantine pool. So we are only talking about reducing classroom quarantine. So if we see a lunchtime situation, we will still track who they fit with. There's a seating chart in lunchrooms with athletics. Joel will go through and review who was in contact and how long, and who guarded who, or who practiced with whom, and we will quarantine those the normal way. This is strictly classroom, fully masked. And if we talk to Amber and we talk to a K-3 teacher that says, you know what, they're not really wearing their mask that well, we'll just go ahead and quarantine around that person as well. We will be more conservative, but in general, the classroom executive order says mask, we will not quarantine, but we will still track.
Dr. Ho,
I hope that's clear.
has the
Thank you.
CDC's guidance changed in the last couple of weeks, or has it remained the same as it was this summer when we
The
came up?
CDC's guideline actually says it doesn't have a whole lot of press as far as New York Times and CNN and who you get your medical information from, but the CDC does say what the governor said is fine for schools. So that is actually in CDC print, because what happened during the reopening plan discussion that we had with Mike and Alan, the rest of the board, the rest of the administration, Ron and everyone, when we talked through that, we actually talked about the fact that what the governor is citing actually is in CDC literature for use, but because everyone went with kind of the reopening plan and the vaccine strategy and the different quarantine levels, it was not put forward. So the governor isn't just creating this from scratch. It actually is in the CDC literature that was instructed, and we kind of debated, should we follow it? But since the world hadn't decided to follow it yet, we decided not to. So the governor didn't create this on his own. The CDC actually has it written very similarly.
Sorry, may I ask you one more question? This is Yue. On the notes Mike just gave us, and it says availability of timely testing is kind of limited, and I wonder how the situation is. And because it seems to me, if students, if we want to reduce the quarantine time, everything, and getting a test is a solution. And so what's the situation is locally, like how hard, how easy it is for the students to get a test?
How hard is it right now?
Yeah, to be tested for the
Well,
COVID.
from the reports that I had with the discussions is at that time of last week, it was up to maybe 2 or 3 days before they could even be tested. I can talk from a personal point of view that my granddaughter had to drive to Avon to be tested because of a close contact. So that's the reality of what's happening. How that is corrected, I don't know that, but I'm just telling you right now that there is a difficulty right now with the testing.
Well, but your question is whether we could have testing here.
I understand it might be expensive for our schools to do it, but I heard actually, the pharmacy, people can do it at the pharmacy, and if they make appointment, they can probably get tested in 3 to 5 days, and it's typically covered by insurance. If not, it's covered by the federal funding or something. And so if that's the case, if it's verified, then can we require those kids to have a test? And
But I think part of the quarantining rules, even if we ask someone to be quarantined, then they could go through the testing procedures if they're available to get them back sooner.
Is it possible that they're not available because they're all being used?
I
Because
don't know that answer.
I would be concerned with a kind of pay-to-play position, because students with any kind of financial or transportation access would not be able to do that. So I would not be in support of that kind of requirement to come back to school. That's not okay for me.
Let's, Chet, Dr. Ho, do you have any other comment on the testing part of this? I mean, in the feasibility of doing
I mean,
that?
I was just listening. I'm trying to understand what the question actually is. Is it about testing at school, or is it just about testing to get back to school?
It's more about the availability of testing.
I think testing availability is, it is somewhat of a challenge in the sense that, it can be done. I heard somebody mention it can be done at pharmacies. It can be done through the clinics. Right now, I was in clinic on Friday. I'm just anecdotally at IU Health. I was in clinic on Friday, and we ended up, kids that I needed tested. I tested about 2 or 3 kids, and I think I got them tested on Saturday. So we were next day testing, and our testing is coming back within about 48 hours. So I think that's pretty much the norm in our community. There's some, peaks and valleys, but it's roughly 2 to 3 days to get it back.
Okay, but the question,
And there's some stories that are worse than that, and there's some stories that are better, but that's about average.
but to be able to mandate testing, in a consistent basis within the district is not feasible. I guess I'm asking that question.
Yeah, and I think that's where, again, I use that line about, there's a difference between public health and personal health, and our job is to manage public health. So, there are times when people will just follow the 10 days because that's the quarantine rule without a test out. But I've said, you may want to get tested just so you can keep yourself, your siblings, and your parents from turning positive. So I think there's a reason to test. That is not always our job as public health, defenders to have everyone get tested. It's really about, personal choice. If I thought one of my kids was positive, I'd want to know if they're positive or not, just so I know if I can be around them or not. So that's that bridge between public and personal health.
All right, let's vote on the
But I
motion.
don't want to mandate testing
Yeah.
for
I
everybody.
got
I
it.
agree with that statement.
Okay. Let's vote on the motion to table for another month, unless there's additional questions or discussion. Okay, all in favor of the motion to table this, if I'm saying it right, for a month, is that correct on the motion, Amy? Please say aye.
Aye.
And I'm hearing 2 ayes. Any others? Amy and Yui. Those that are not in favor of tabling, please say aye.
Aye.
Okay, so it is not tabled, at least currently. So any other questions or discussion for Dr. Ho?
Dr. Ho, this is Rachel Witt. I just want to thank you. I came in tonight very conflicted about this. Personally, I still am. But I really, you and Dr. Biancali have been with us from the beginning with this, have given us excellent advice. I want you to know that I appreciate that. And it's because of that advice that I'm slightly more comfortable. Thank you.
Other comments?
I have a couple of
Yeah, go ahead,
comments
Amy.
I'd like to share. According to a U.S. News article from September 3rd, 22% of the COVID cases in the United States during the previous week ending August 26th were pediatric cases. And I'd like to also state that the hospitals and the mayor came out with a video urging greater caution because the hospitals are full, and the positivity curve that we've all been watching for a year and a half is at about a 120-degree angle right now, and I don't feel that this is an appropriate time to change course.
Other comments? Thoughts? Jen, any response or anything else from your perspective on that, please?
Sorry, may I?
Go ahead.
I mean, I think the data is data. It is, what it is. I think, it also speaks to the fact that, tell all your friends to get vaccinated. I'm not trying to be funny, I'm being serious. So, I think increasing vaccination rates, will still get us to a point where we are less concerned. And most of those kids, I will tell you, are turning positive because of their adults, not because of their getting it kid to kid. Overwhelmingly, our transmission is in family silos. So it's not every kid turns every other kid positive. It's, adults that are, and others that are not vaccinated that are continuing to spread the virus and the variants.
I would love to get my son.
I'm not here to dispute your data. You're 100% right that we are worried about it. But I think what we're trying to say is in a classroom setting where everybody's wearing a mask, that we feel comfortable that our data has shown that we've not seen major transmission between student to student that are in a mass situation. That there's plenty of transmission and we're plenty worried about this, 100%. And the numbers of pediatric cases are definitely on the rise. So we're all looking forward to vaccine safety data among kids under 12. and getting more of the kids that are 12 and 18 getting vaccinated. And so I think that's really that message of the data that says we need to be concerned with that. But I think we're still trying to make sure we keep kids in school and not missing 2 full weeks of school, both for social and academic reasons, in order to say that we're comfortable in that specific setting. Not in all settings. We're not talking about taking off masks, and not wearing masks. We're talking about in the settings that we're very comfortable, we're fully masked. We feel comfortable relaxing the quarantines of people sitting home for 2 essential weeks of school, 5 days and 5 days is 10. So that's kind of what we're speaking to. But the data is real, and it means we all need to be diligent, we all need to wear masks, and we all need to get vaccinated.
I'd love to get my son vaccinated, but he, along with half of our students, isn't eligible yet. So if you can sneak me one, that'd be great.
Dr. Yin, go ahead.
Yeah, I just have a question about the vaccination rate for students from above 12. And because on the note it says a substantial number of students have been vaccinated, but I wonder about the percentage. Do we happen to have that information? I know personal data is confidential, but do we happen to have any aggregated data regarding the percent of students?
We do not.
We do not
have that data.
Okay, can we collect that data at all? Are we allowed?
We have not, we have chosen not to ask our students those individual questions.
That we have, but it is that data is available, or that in an individual basis on CHIRP, it is available, correct?
It is. And I can ask if we can pursue that data, but that's been, that's back to that personal type of thing. But Alan is right that from CHIRP, that is available.
But only to the nurses, from what I understand, correct?
Pardon?
Only to the nurses.
Only to the nurses.
What would we hope to do with that data exactly? What would that change? What would that change in terms of our course of action?
For at least for high school, and you feel better informed, and you know your peers. Let's say if 80% of the students are vaccinated, you feel safer. That way, at least Purdue has that data, right? As far as I know.
They have announced that data, I believe, as well.
So now that I know how to make motions, I'd like to make another one. Can I move that we change the policy for the junior, senior high school, but keep it as it is for the younger grades who are not yet eligible for vaccination?
You have a motion on the floor right now, so you
Well, we've already voted down the table.
Right.
We still have a motion on the floor as originally stated, so we need to continue this to go through that part of it. It's not a tabling motion.
Okay.
Then can we get some clarification regarding the lunchtime close contact, that sort of, because before we only talk about the classroom quarantine is not necessary, but for the lunchtime without mask, and actually that rule won't be applied, right? So that means we keep the original plan for the lunchtime close contact?
Well, the executive order is just for classroom time.
Just for class.
It's only for class?
That is the executive
Okay.
order, it's just in the classroom.
So for other situations, the indoor sports and the lunchtime, it will stay the same as now?
Right.
Correct.
That's what he has said, that if in the same situation with it just pertains to the classroom.
Mm-hmm.
Okay,
Okay.
and I'd like to emphasize too, that while the new guidelines are relaxing the close contact rule, that doesn't mean parents, if they've been notified that their child's seatmate to the left or to the right of them has tested positive, the parents can choose to quarantine their child for 10 days. They have some say in this matter now too.
Okay, so they will be notified The
Yes,
parents will be
absolutely.
notified if
Oh,
their kids sit to,
That-
close to a
Yes,
positive.
let's please clarify.
Mhm.
If somebody tests positive, whether it's in the classroom, on the athletic field, at lunch, or at recess, close contacts will be notified. Now, the relaxation of the quarantine rules pertains to just the classroom. But parents can choose to, well, I want to keep my child out for 10 days. So their parents may say, okay, I like the new rules, I want to keep my kids in school, I will monitor them daily as for their symptoms.
It says right here, K-12 educational institutions and child care facilities must continue to perform contact tracing activities and provide parental notification to close contacts to allow for the monitoring of symptoms. So that there's a must in there. So the parents must be contacted.
When will we be reassessing?
Go ahead. I'm sorry.
When will we be reassessing this? Will we have to wait until the next school board meeting in order to change course if this doesn't go well?
Well, again, well, Chet, if you want to address that, but I mean, it's an understanding that if there's anything that indicates that something has changed, we will change things on a dime. I mean, that's what he said earlier. Is that a fair characterization, Dr. Ho?
Yep, I was just gonna say, not to be funny, but I'm being dead serious, we will reassess it every minute. Because we honestly, I'll just tell you, I'm not saying we're better than other schools, I'm just telling you, you get basically 24/7, your nurses are monitoring the students, staff, employees, 24/7. We're texting on Sundays, Amber and I have had plenty of, Sunday texts, and so we're addressing it on a regular basis, and we will see it. If we see quarantines that turn positive, if we see close contacts turn positive, we'll notify those parents immediately, and, we will actually reassess it and talk to Mike and everybody, that day if we need to. So we will reassess and monitor this closely. I feel very comfortable that we're gonna try to keep more kids in school, but we will not, do it at the expense of closing our eyes for a month. It'll be reassessed every minute.
And again, one other thing that's important is, while I think it's important that this is brought back to the board, again, it is our administrator's role and teacher's role to make sure that this is properly dealt with. It's not the board's total purview on this. So, I mean, it certainly is it's certainly in the purview of our desire to keep our students safe, but there are a lot of districts, not that that's correct, but there are a lot of districts that this is not even a board issue. Just saying. Other questions? So we can.
So just to clarify, for Willis and Willis, kids at lunchtime have assigned seats, right? Is that the case?
Yes.
So in that case, it will be quite easy to do contact tracing.
Yes.
Yes. Is that true, Amber? It's easy, I mean.
We have seating charts for every single place. We have line order for every single classroom of how they even travel down the hallway. So we have assigned seats in every single location. They're all documented and uploaded so that I have access to them 24/7 should I need to do contact tracing.
Great, thank you very much. And then for the high school, and kids have more freedom to kind of sit around, and I assume, but good, right? So, but we still have, just now Dr. Ho said we have some like a video or something to track.
Right, and again, like we said, this pertains to the classroom, okay? And the rest of this, it's still the same, with lunch, athletics, we have the ability to track completely where they are, what they're doing. We've said that a
Just
couple
like
of times.
before.
but it is
I don't
actually-
think we can discount either. By the time they're in 7th through 12th grade, they are capable of speaking and communicating with their parents or teachers or other people, and they understand their environment. They are responsible for their masks. They're responsible for asking questions. No, they're not perfect in that, but the students do have, and I have seen a measure of accountability for their personal behavior. So I would expect that would continue.
Other, Dr. Ho, anything else from your perspective?
No, just just want to make sure we're clear. This is just the classroom. I'm getting a lot of clarifications, and I'm trying to be exact. This is specifically in the classroom setting, and the vigorous monitoring will continue regardless. Doesn't mean that our nurses will take time off or stop being vigorous.
All right, we have a motion on the table and a second. Any other questions?
Can I move to amend it to just be the high school and the junior high rather than all three?
She can make a motion to amend, and then again, you didn't need a second, then you'd need a majority of the
Okay.
board.
You can make the motion to amend, and then do we have a second to that motion?
Okay, then I move that we amend it to only change the procedure at the junior, senior high, and to leave the procedures as they are at the younger schools.
Okay. Second? Okay, we don't have a second, so
So,
we'll go back.
dies from lack of a second.
Lack of a second, so we'll go back to our other motion on the table. All in favor of the motion, please say aye.
Aye.
Opposed?
Nay.
Okay, 6 ayes and 1 nay. The motion carries.
Thank you.
Thank you, Dr. Ho. We appreciate your time very much.
You bet. Have a great day.
Okay.
Thank you.
All right, we will now move, we're done with the budget. Start of school update.
Yeah, I just have several things there. Number one, I've talked to each of the principals I've met with, and that were about the suggestions to me, the class sizes are positive, and I listened to understand that the class sizes at West Lafayette are less than what they are in many, many places. So when even at West Lafayette though, the administration has reported that the class sizes are positive. We are looking at an anticipation and looking at class size, the total enrollment within the district. We're not exactly sure where that is at, and you guys kind of have a moving target because of the way that students that come from TSC are counted on the TSC numbers and not on our numbers, and then there's a pay on that. But in 2020, the ADM count was 2,316. Right now, there's an anticipation, and I'm giving this an anticipation because I've been instructed not to make this a hard number, but the anticipation is that hopefully that number will be a bit greater than the 2,316. Knowing still from talking to Mr. Sloat over the years, that is still down from the 2019 number. Am I correct on that, Ross? Yes. So anyhow, but that's
ADM day is,
our ADM day is I'm not exactly sure on. I think it's like the 17th of September.
17th.
Yeah, it's a Friday. It's one of those Fridays in September. So that is on that point. So that's my start of school update, and I appreciate the work of the administration and the staffs as I visit buildings. It is a good thing to be in buildings and have kids and see that in-person instruction. And I'm going to make this comment is I appreciate this, and I look back here at Amber, and me spending 15 years in the elementary school as a principal, I just want to say this: the important learning takes place there, and the emerging readers is really the key to being successful within our district. And when we talk about the amount of quarantining and kids missing schools, I don't worry about the advanced chemistry student. I worry about the emerging reader. And I'm a little nervous statewide about how the iRead test in this spring in 3rd grade will flush out. And there is enough evidence that already there's some warning signs out there. So I just want you to know how much I appreciate it, and I've spent a little time in Amber's building, and I know how hard that those staff members are working, and understanding that concern. So that's my comments on the start of school.
I just think from a board perspective as well, that also the work of Ross and Steve, Ross Sloat and Steve Oldhoff too, and on many things to kind of keep all that together is greatly appreciated.
Ross and Steve are, and I say this, I mean that Ross and Steve and Roberta sitting behind
Absolutely,
you
Roberta as well.
are key people that are maintaining the momentum of this district, so.
Thank you. Attendance policy update, and back to you, Mike.
Okay, do you want to
we
do this,
skipped
do you want to do
No,
this,
sorry,
the
I'm sorry,
superintendent?
superintendent search update, I'm sorry, go ahead. Dr. Springer, if you want to give a brief update.
Just wanted to thank everybody who completed the superintendent quality questionnaire, either online, and to those who attended the forums on August 23rd. The compiled data from 438 responses is posted on the corporation website under the Superintendent Search tab. And also newly posted on that tab is an article on public versus confidential superintendent searches. Two of the main responsibilities of any school board is to create policy and to hire the superintendent. The board has met in executive session and reviewed applications, and the board is currently planning first round interviews.
Okay. Anything else? Thank you, Dr. Springer, for the update. Now we will move to attendance policy update, and Mr. Pettibone.
Yeah, you have in your packet an attendance policy update, that is for Willis, and I am asking that it be approved as presented so that it can be updated in the handbooks at that level.
Okay.
So moved.
Moved by Mrs. Witt,
Second.
second by Mr. Schott. All, discussion or any questions, please? Okay, all in favor of the motion, please say aye.
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 And opposed, hearing none, that motion carries. We'll move now to, if I'm keeping my scorecard right, Happy Hollow Lease and Mr. Sloat.
Yeah, you have an opportunity to lease around 3,000 square feet to a church. It's called the Church in Lafayette. They would use several rooms on Sundays from 9 to 1 p.m. and some Tuesday evenings with additional 5-hour special events on the library on occasional Sundays, and the cafeteria one Sunday per month. The term we've recommended is for a year. We have a right to terminate the lease upon 6 months written notice to the tenant in case some other options would become available. The lease amount is $1,500 a month. So we'd recommend consideration of this. And just to summarize where we're at on the Happy Hollow, that would give 3 entities that have entered into the lease. This would be the third one. So we have like Glass. Remember, we leased some rooms to Glass. We get $22,000 annual lease payment from them. Patents, which was special education equipment provider, we're getting $2,500 a year for a small room, and then with the church added to that, this would give us roughly $42,000 of annual revenue with these 3 leases. So we'd appreciate your consideration of this third lease that we've drafted.
Need a motion, please?
So moved.
Moved by Dr. Springer. Second. Second by Mr. Marlowe. Discussion, question.
Ross, does this displace any West Lafayette school activity or program?
No.
Thanks.
Other questions? All in favor of the motion, please say aye.
Aye.
Opposed? Hearing none, that motion does carry. Cell tower update, and Mr. Sloat.
Okay, we've had some discussion on a possible lease for cell tower, and we have with us tonight Brett Blackhurst, if he would come up to the microphone, Brett. while he's coming up, quick summary, we've gotten information, I've distributed information to you, several of you sent questions in, I got him to respond, sent them back, then there's some more questions. So we'd like to, our goal tonight would be to see if you have additional questions, he can briefly kind of explain the situation. What I understand that Black he's from Fortune Wireless, and he is a go-between between Vertical Bridge, who would be the owner of the equipment, and would be leased to T-Mobile. And currently, as I understand, they have equipment on the water tower of American Water, I believe. Is that right, Brett? Yeah. And so that lease is being terminated or not renewed, so they're looking at another option. We've discussed having it over at the athletic field area, you know, either on the football field, or you probably could go back to the northwest to the soccer area. I mean, that'd be another consideration. You know, they're talking about, and he'll go into this, we were talking about a lease. It's 5 years at a time, but they would offer up to 9 renewals. The pricing, he'll talk about this, I'm sure. If they did $12.50 a month, that's like $150,000 over 10 years of possible revenue. And that's without the escalator clause, and he can talk about that a little bit. But what I sense from the board, there's more concern about the location of the equipment. Does equipment make noise? Is there, kids get into the stuff and get hurt and things like that? So I've asked Brett if he'd come and address some of these issues and open it up for questions.
Yeah, I've supplied a bunch of the communications that I've had with Mr. Sloat and myself. And he said that you guys had some concerns, some questions, so I, kindly asked him to please provide those so I could be prepared, elaborate with them a little bit, and that way provide it to you. I did supply a summary of our communications through the time from this summer. Yes, this is a built-to-suit for T-Mobile, but it will be a vertical bridge tower. They will lease it out to T-Mobile. T-Mobile is currently on the water tank. That lease has expired. They are now on a month-to-month basis, so they need to get off of there. I do not know why they haven't renegotiated a new lease with them, but to be honestly, some of the utility companies like having additional revenue, but it's also a headache to them, having carriers up on their water tanks for maintenance reasons, painting reasons, and so forth like that. As far as the escalator, that would be a 1.5% escalation increase annual. That's as high as Vertical Bridge will go. They're locked in with the NLA with T-Mobile for that. I do not really feel comfortable talking rates in a public forum, so that can be discussed on the side. They are looking for, it's just an opportunity for the school districts to get additional revenue for you guys. We need to try to stay in the same area where T-Mobile is currently at, so we get a supply or a search ring that we're trying to find. This whole area where we're at is all residential, so it makes it really hard for carriers or tower companies to have a zonable, tower in that area. As I said with Mr. Sloat, they're looking at a 50 by 50 lease area. We're open possibilities to work that works well with you guys, the school corporation, and Vertical Bridge themselves. We talked about maybe a athletic light pole replacement. It would be pretty much the same as your light pole is now, but it'd be a little bit more sturdy, higher. They're looking at 150 foot tall. The equipment will be on the ground. It doesn't necessarily have to be right directly underneath the tower, but it has to be pretty close. I think 100 feet is probably the max that they could move the equipment away from the actual structure itself, and then the lines would be on the ground to that structure. Let's see, what else can I tell you?
There was questions, I know some of you asked about, well, is there, do they have a generator down there that if the power goes out, it kicks in? Is there noise and things? And you may address some of those.
This is a T-Mobile, going to be a T-Mobile equipment. I do not know the specifics if they will have a generator on site or not. Like today, I was out for T-Mobile sites looking around. They are adding generators to a lot of sites. They are boosting up their 5G network since their merger with Sprint. So that I cannot confirm that they will have a generator. If they do have a generator, it's probably a 25 to 30 kilowatt diesel generator that is muffled. So it will go off when the power goes out, but it doesn't go off all the time. Some carriers do periodic testing to make sure that their equipment is functional for those generators. They do have cabinets, ground equipment that are there, and they'll have a little small motorized fan in those cabinets to help cool the batteries and the equipment underneath. But that's just a faint humming sound that periodically goes and the fan runs.
Other questions or comments?
I think it will be identical to the equipment that's on the ground at the water tower right now.
Let's see, it's probably been about 25 years. They do change a little bit. I haven't gone over to that site where they are at the water tower. All of their equipment is outdoor equipment.
Yeah. It's got a generator set there right now.
It does.
Yeah. And there's other panel boxes next to it. We're just trying to get a feel for how intrusive this is gonna be on the site, so we can put it in a safe place where people won't be climbing on it or running into it. We're talking about our football field.
Right.
We just wanna be safe.
Yeah, I completely understand that. It will be fenced in. All the equipment will be fenced in. And they'll have anti-climb barbed wire up on top of it, usually probably a 6-foot tall fence. We can put landscaping around it. A lot of the jurisdictions do require that anyways, so that can deter them from getting in there too.
Lefty, have you got any ideas for where this could go?
I would say the northwest part of the complex, or else the northeast. Well, you would have across the street, I guess. The northwest would probably be the best with nothing immediately there. You got the woods behind it, and there's a pretty good set back from the friendship house.
That's the corner of the soccer field,
Yes.
the northwest corner.
Yes. I mean, as you stand at the south end of the soccer field, it would be back in this corner.
Okay, gotcha.
Is there a pole that's close enough to that site?
Pardon?
A pole that's close enough to that site?
Are you talking about a light pole?
They're gonna put a vertical up 150 feet, so we need room for that and the equipment center.
What are the dimensions?
Dimensions of,
What you would need?
if you're looking at just for a new structure and not a pole replacement, it will be a 100-foot monopole. There will not be any guide wires. They will require a ground space to host up to 3 different carriers. A lot of the municipalities do require that for the new sites anyways, to help reduce the number of.
But what I'm asking, you need a 25 by 25 yard, or 150 by 250?
We're looking at preferably a 50 by 50 foot lease area, or we can go lower than that too.
There might also be, Brad, I'd have to go up there tomorrow and check, but there might also be room actually back behind the maintenance barn. Yeah. 50 by 50 might impact, like behind where the corner kicks are, that type of thing. But
Is there a drive access for crews to get in behind that building?
Well, there is, there would be, because you could drive, we've got access at both ends of the maintenance building. Now, what's stored back there right now, since I haven't been up there for a couple, 3 years now, and actually going out and back, I don't know. I mean, there were things back there, but it wasn't anything that I think couldn't be moved to get trucks through there. But the bay, the wash bay that we have in there has got very high, the overhead doors in there are very high, that I think they could get their trucks in there and get back.
I think what I'm hearing is that we need to have some of that things clarified, I think, from where it's actually going to go before we can really, we've answered some questions. Maybe we can bring this up as a next month's board meeting, if that's the will of the group. Does that make sense?
Yeah, it makes sense, Alan. I think, I want him to come to, see if he had other questions, not that you gotta make a
We
decision
appreciate your
tonight, but
responses. Yes.
I think the question is, if you're not really interested in moving ahead, then we need to know that, so we don't spend more time investigating. But if you kinda like to know more about it, and sounds like we may have some attractive spots, we can certainly look into it in the next several weeks and get, kinda firm up.
I don't, okay, this is one person speaking, but I don't see any reason not to find out more, at least from a space standpoint.
Let's at least figure out where we can put it.
Yeah, and then
And if
we
it's
can
out of the
decide.
way,
I know we have some
yeah,
debate
free money.
on that, but I'd like to have a clarification of where we can actually put it, and then make that decision.
And I'd be happy to come up here and do a site visit with you guys too.
By any chance, we can also solicit community input regarding it? And personally, I don't like to install this on our school property, and I will be worried about radiation, possible radiation, and also, even though it's not close to our schools, but it's close to some of the neighbors. And but I wonder how the community think about this, or maybe people like a better signal of their cell phone, or I don't know. I just feel for me at this time it's hard for me to make a decision on this, and I wonder by any chance we can solicit.
Well, I think you have the right to go ahead and, if you have people that you want to talk to regarding that. I do think with respect to where it's located, we would do our due diligence of making sure that if it was located in a situation where it was close to others, that we can get that information.
Well, don't forget, currently it's on a water tower in a residential neighborhood.
Right.
So neighbors have been living with that for multiple years.
Yes, my other question is, just now you mentioned that you don't know why they terminate their contract, and I wonder why. Is it possible to figure out the reason for their termination?
Their lease contract was up.
Yeah.
Their renewal time, they went through their 25 years, that was up. The utility company and T-Mobile couldn't come to an agreement on a financial thing. There's been stuff like maybe T-Mobile hasn't paid, but that's just all hearsay, but they still wouldn't be on that tower from a month-to-month basis right now if that was the case. This is not going to be a T-Mobile site. This is going to be a vertical bridge site, which is one of the 4 major tower companies in the United States.
Then if it works out, your company will pay the rent, not the T-Mobile.
Right.
Yeah.
Vertical Bridge will pay the lease rent.
Vertical bridge, right,
Yep. You guys would be leasing to Vertical Bridge.
not to T-Mobile.
Right.
Yeah. Other questions? Short term?
As far as the RF emissions, none of the ground equipment will emit any RF emissions, only the stuff on the very top. But by the time it fans out and hits the ground, it's 1,000 times less than what the FCC requires for safe exposure. Some of your household equipment, baby monitors, microwaves, has more RF emissions than what the signal does when it hits the ground.
Okay.
Thank you.
All right, Thank
Good
you
to know.
very much.
Thank you.
Appreciate it very much. We'll look at this in the next month and may come back to that.
Okay, thanks.
Thank you. All right, we will now move on to donations.
Yes.
ECA dance team and instrument for Willis, and back to Mike.
Yes, I'd just like the board to officially accept a donation in the amount of $5,000 by Mr. Patrick Malone to the WLCSC dance team. And also a cello has been donated to the WLIS orchestra. And I would like to please have these noted in the minutes. Thank
Okay,
you.
need a motion, please.
So moved.
Moved by Mrs. Witt, second by Mr. Schott. Discussion. Thank you for the donations. Yeah, go ahead.
Yeah, I really appreciate their generous donation, and I just wonder, by any chance we can, before actually I mentioned this before at the earlier some other meetings, similar comments, and so, but I'd like to emphasize again is whether we can formally acknowledge their donation if they allowed us to release their name. For example, I just put the donation on our meeting minutes, and I noticed that they are not.
Precisely what we're doing right here.
They are not on the meeting minutes before, so I wonder whether we can.
Make sure, but since they were mentioned here, they would be on the meeting minutes.
Okay, just want to
Okay.
acknowledge their donation. Thanks.
Understood. Thank you. Any other questions? All in favor of the motion, please say aye.
Aye.
And opposed? Hearing none, that motion does carry. Personnel report.
Yes, I'm asking for a motion to approve the personnel report as presented.
Need a motion, please?
So moved.
Moved by Dr. Springer, second by Mr. Marley. Discussion, questions?
Just a comment. And I'd like to say thank you to the teachers. I noticed that on the report, many teachers actually sponsored a bunch of extracurriculum activities, and I understand that they do that on top of their heavy teaching load. I'd like to express my appreciation to them. Thanks.
Duly noted. Anything else? Okay, all in favor of the motion, please say aye.
Aye.
And opposed? Hearing none, the personnel report carries. Accounts payable, and Ross, will go to you.
Yeah, we have a total of $3,308,315.63. That is 2 payrolls, claims, our claims, WEVEC claims, construction projects. Couple items to note: Lafayette School Corporation, we have 2 payments there. One's $211,000, one $15,000. That is our glass payment for half a year. Straight lines was $2,100. They did restriping at the high school parking lot. A couple other items: Riggs Outdoor Power Equipment, $12,834. We bought a new zero-turn mower for the grounds crew. And we had also a quarterly payment to Henriot, $31,391 for some of our property insurance. And then also a quarterly payment to Greater Lafayette Career Academy, $29,749 for our share of our payment to the Career Center. So we recommend your consideration of the claims.
Need a motion, please?
So moved.
Moved by Mrs. Austin. Second.
Second.
Second by Mrs. Witt. Discussion for us to pay our bills.
So may I ask just a clarification? So our payment to the Career Center is for what kind of service? Career Center, you just mentioned.
Usually this, I'm talking from experience.
Uh-huh.
The payments to the Career Center, number one, there may be a membership that we have involved automatically, but most of your payments to the Career Center are based on the number of students that we have enrolled in the classes there.
Okay.
And then they bill the school corporation accordingly.
And I don't know if there's.
Yeah, that's correct. There's basic, some overhead costs that they charge, but it's based on our enrollment. I mean, they take the overall enrollment, you know, you got so many students in a class, divide it by the cost of that class, and we pay our share for our students in that class, so, yeah, I'm sorry I wasn't clear on what the question was, but, you know, Mike answered that correctly, so that's
So
what
there,
it is.
there are a variety of school corporations involved in that, in the Career Center. So if there are 5 kids from West Lafayette and 5 kids from the Lafayette School Corporation and 5 students from the Tippecanoe School Corporation, then the cost of that class would be divided among those 15 students, and then they bill the corporation accordingly.
Okay, so basically our students can take classes from there.
Yes,
Okay,
yes.
thanks.
You can go to the website, UA, there's a lot of really great information about the Career Academy, and a lot of our students take advantage of that, if you
Okay,
get a chance.
it's for high school students, right?
That's correct.
Okay.
Okay.
My kids are too young to know that.
Okay, any other comments? All in favor of the motion, please say aye.
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 And opposed, hearing none, that motion carries. Information of the board, I don't have any additional board and superintendent reports. Amy, I'll start with you. On the end, anything in your,
I had a conflict, so Tom attended that one.
okay, sounds good. Brad?
I don't have anything to add tonight.
The only thing, we're still in the process of beginning our negotiations, which I'm on the committee with Brad with that. I think that's probably my main report at this point. Dr. Springer?
So from the park board, youth basketball and adult volleyball will start this fall at the Wellness Center. And then the youth summer camps the camp experience is going to expand to include a winter break and also spring break camps. So one spring break camp for West Lafayette schools and one for the Tippecanoe County schools. The Lilly Nature Center at the Celery Bog reopened on July 7th after a 16-month hiatus, and a list of programs and hours can be found on their website. The first the first of 4 governing board meetings for the 2021-22 school year will be Tuesday, September 21st.
Rachel?
I don't have anything.
Foundation met August 12th, just a couple of dates, looking ahead to 2022, March 26th. Will be the return of what used to be West Side Story, now be rebranded as a West Lafayette Schools Gala, scheduled for the Ross-Ade Stadium Pavilion. And April 8th is the Wall of Pride, next round of ceremonies. And 3 new members on the board of directors, Tanya Finkbeiner, Bill Price, and Greg Theobald have joined the group. So,
Thank you. Dr. Yan?
I attended the Public School Foundation meeting, and there are 2 events. One is the Cupcake Run and fundraising, and which will occur on September 19, 9:30. They encourage enrollment, registration, and Duke Energy actually will match the donation people make, which is great for the foundation. And another thing is the grant application. Teacher grant application deadline is September 27th, and they said they already sent the notice to principals and encourage teachers to apply. And so maximum fund is $2,000. And they also encourage all kinds of collaborations between teachers, across schools, and even across districts. Another thing is, we also got some update from other school districts, and in particular, TSC actually, they said their enrollment is historically high. They are quite overwhelmed by students, so I mentioned it to the superintendent regarding the transfer, and he said actually they don't mind if students transfer to ours for now before they have, more capacity to keep their students. It's okay, if parents choose to transfer to ours. Surely there's a procedure, but just because at the last meeting we talked about this issue, and I asked him about the transfer issue, they said that because they're high enrollment, they are actually quite overwhelmed right now. They are short of staff and short of bus driver, everything.
We don't have any communication beyond its non-agenda items. Our next regular board meeting, Monday, October 4th, 6:30 PM. And I believe it's going to be here. And we're still, yes, okay, still through that. And I'll take a motion for adjournment, please. Moved by Mrs. Austin,
Second.
seconded by Mr. Schott. All in favor of the motion, please say aye.
Aye.
And opposed, we are adjourned. We do have some things to sign, so